Hello and welcome to Gravitas. I'm Giles Gibson. Later on, we'll be breaking down for you accusations of Chinese military installations in the disputed South China Sea. But first up, we're discussing the President of the Philippines, Rodrigo Duterte's war on drugs. Since his election in June, police say they've killed over 2,000 drug offenders in self-defense. Another 3,000 killings are under investigation and possibly linked to anti-drug vigilantes. Duterte says he'd be happy to slaughter 3 million drug addicts, but his critics accuse him of mass extrajudicial killings. Before we get into our discussion with our live guests, let's take a look at how Duterte's tough policies are playing out on the ground in the Philippines.
5,000 deaths since July, and the slaughter shows no signs of slowing. Rodrigo Duterte says he's cleaning up his country's drug problem. But families of those caught up in his war on drugs say that addicts don't deserve to die.
Droga. Alam ko droga masama. Wala talaga ikabubuti sa bata yan. Pero bigyan nila ng pagkakataon na mabuhay, magbago. Bigyan nila ng trabaho para makapag-aral kaya ikawawang anak ko. 19 anyos, hindi man lang nakapagpamilya.
Human rights groups in the Philippines and around the world are calling for an investigation into what they say are extrajudicial executions. But the Filipino president is defiant after using expletives in his reference to the US President Barack Obama in September, personal insults on the international stage, and Duterte has now revealed that his war on drugs is also a personal crusade.
I must admit that a third of the killings really happened during police encounters. But in Davao, I used to do it personally, just to show to the guys that if I can do it, why can't you? And I go around Davao with a motorcycle, with a big bike, and I would just patrol the streets and looking for trouble also.
As the bodies pile up, Duterte is more and more isolated internationally, but increasingly defiant. Bureau Report, WION.
All right, to discuss this issue and drugs policy in general around the world, I'm joined by Kunal Kishore, who's a coordinator of the HIV and AIDS program of the United Nations Office on Drugs and Crime. Kunal, thank you very much for joining me this evening. Let's just start with that report we saw on the Philippines. How is Duterte's drug policy being seen on the international stage amongst the drug policy community which you're working in yourself?
Thank you, Giles, for inviting me. Let me begin by first expressing our condolences for people who use drugs and have lost lives in Philippines. To respond to your first point, let me begin by saying that what you are seeing in Philippines is largely, building on what many countries do, an erroneous sort of hypothesis that supply reduction is a solution to the larger drug problem, and that is what we are getting to see. And to talk of what is the UN position on this, I think our Secretary General way back in June this year, and then later our Executive Director sometime in August had reiterated very clearly, that it is against it is obviously violation of human rights, and it's against the international drug conventions. And the way to deal with it is to work with people who use drugs and engage with a health-centric approach.
All right, stay with us, Kunal, because we're joined now by Maria Ressa, who's the executive editor of Rappler, and she's joining us on the phone live from Manila. Maria, thanks very much for joining us in this discussion. I just want to get a sense from you, how much support do these tough drug policies by the Duterte government, how much support do they enjoy in the Philippines in general, would you say?
Tremendous support. Survey from the time he was elected by 16 million Filipinos out of 54 million voters. He campaigned on a promise to actually kill people, to go fight against crime and drugs, and to clean up the streets. And resoundingly so, his latest survey shows that he's got a 77% popularity rating. This is according to the Social Weather Station survey in the Philippines.
And Maria, we're seeing this mounting death toll. By some figures is up to 5,000 deaths somehow linked to Duterte's drug policies. Is that affecting his popularity ratings in any way?
His popularity has slipped from a high right after he was first elected, and it slipped several points. This latest survey, just released today, actually shows that more than 50% are wary and want him to stop publicly criticizing other world officials, global leaders. But what you're seeing is a death toll that has surprised Filipinos and certainly has had more critics here in the country talking against the drug war. You have a death toll that is more than 6,000 in a little less than 6 months.
All right, let's go back to Kunal, who's with me in the studio. Kunal, we were talking earlier about general drug policy. Do you see this as you work in the drug policy community, do you see this as an extreme end of what the US have been doing, their so-called war on drugs since the 1980s, since Reagan, or is this something completely new in terms of what Duterte is using, his tactics?
War on drugs is not a very new phenomenon, especially in the Southeast Asia context. But certainly it is very surprising given that only this year, early in April, we had this UN General Assembly special session meet on the world drug problem after almost two decades. And one of the very good outcomes from this meeting was that the world agreed that it is a public health rights-based issue, and it should be handled in that sense. So some of the developments around the drug problem, especially starting with the Philippines, is indeed surprising. And it is shocking also because countries in the vicinity of Philippines also, for example, if I can take an example of Malaysia, Malaysia has in the past tried a full-on supply reduction, law enforcement-driven approach, and it, for reasons similar to Philippines, it shifted completely to a public health-based approach where it scaled up programs such as methadone and got the entire drug-using community on the treatment fold, and they have achieved much success. But to say that what we are seeing in Philippines will yield any result would be absolutely wrong, because there is no evidence for such things to happen. And wherever supply reduction goes solo, you see very little being achieved out of it. There is no evidence that we have seen for so many years. And it's not new in the sense that some countries have also tried this with the opioid problem. And what we now see, that opioid problem get overshadowed with the new methamphetamine or amphetamine type stimulants problem. So yeah, right. We need to look at it as with a very softer, people-centric, health-centric approach, which is what the world has agreed to.
And Maria, back to you in Manila. Our studio guest here, Kunal, is saying that there's very little evidence in other countries that this kind of supply chain-focused approach has any actual impact. Are we seeing any evidence of any impact in the Philippines itself? It's, of course, 6 months after Duterte was elected.
It's probably too soon to tell, but certainly critics here in the Philippines have pointed out that exact same, the data they've brought up. I mean, what you've seen is President Duterte, again, extremely popular, but at the same time, he throws around numbers to justify the drug war, numbers that have not been validated by his own administration. So, for example, he'll say he'll move from 3 million to 4 million drug addicts and pushers, keeps it that general, while the government's own dangerous drug boards puts that number at about 1.8 million. So critics have pointed out these discrepancies, and at this point, what we've seen is an average of at least 32 to 35 people killed every night since July 1, the day he's taken office.
All right, so I'm going to ask both my guests to stay with me. We're just going to go through break down some of the effects of this policy and how it's playing on the ground in the Philippines. And Duterte's nationwide war on drugs is only 6 months old, as we've been saying, so it could be too early to measure its full impact. But let's take a look now at how it's played out so far. Duterte's war on drugs has claimed around 5,000 lives, according to some reports, and more according to others. Reports say many of those killed were reformed addicts or innocent victims. Campaigners, meanwhile, say the police are acting without any restraint. There's also no judicial oversight or any review. And it's not clear if the crackdown has had any impact on the supply and movement of drugs. Maria, I want to go back to you in Manila now. I just want to get a sense of where that figure of, we've been looking into the figures today. The police are saying 2,000 victims from self-defense, essentially, when they've been trying to deal with people involved in the drug trade. Where does that 6,000 figure that you were quoting just a few minutes ago come from?
Both those numbers are from the Philippine National Police. They're official figures that have been released by the government. The police count more than 2,000 killed in direct contact with police operations. But the rest of it, of the far greater number, nearly 4,000 were killed in either extrajudicial killings or drug-related deaths. So they're being lumped under a DUI, deaths under investigation. But all those numbers come from the police.
And Maria, are there allegations that this is not just drug-related, that these extrajudicial killings are coming in other parts of the society and other crimes as well?
They're connected to the drug war in the sense that the police claim they're either extrajudicial killings or, well, they don't use that word. They use deaths under investigations, but they could also be, they've been termed vigilante killings. People who are allegedly related to the drug trade who are killing each other because of the crackdown against them.
And Kunal, I just want to broaden this out for a second. Do you think this is really focusing on the wrong end of the process? Can you cut the supply chain at the very beginning? Is that a more effective policy that the Philippines should be looking at?
Absolutely, but let me take you a little bit back, Giles, to explain. When I was talking in the beginning about an erroneous hypothesis that, if you only do supply reduction, you will deal with the problem. So what also this confusion entails is that, you go out on the streets and you find all the suppliers or the smugglers or people, involved with the, money laundering and supporting terrorism who need money in big scale. Obviously not. I think when you do all the things that you are seeing in Philippines, you end up picking up on drug users, people who perhaps or rather for sure need social and health support, people who need treatment. So you don't necessarily find big smugglers sitting on the streets to be caught. So I think this confusion is what is, made things worse in Philippines and likewise in many other places. What needs to be done is to understand that should supply reduction be successful, it needs to be backed with very good demand reduction and harm reduction programs, which is what our office advocates and which is what was agreed upon by member states with much deliberation and discussion. So in Philippines, we are seeing a very solo effect, and one has to understand that when you also look at it from a legal policy perspective, when you go with this policing kind of an approach, the other thing it does is it's further sort of marginalizes the already hidden sort of drug using populations, and they don't come out. So the numbers that you were quoting really surprises me, not because there's 5,000, but it could be far more, because you don't know what is happening in the communities in the absence of healthcare and social support systems. And I don't know where it is headed, because this could have a spillover effect in other neighboring countries who've been kind of contemplating similar measures. So yeah, it is a challenging period, and I think the way to go about this is for the international community to come together. And even for that matter, countries like China, if you see in the past, China had wanted to contain its HIV program, and the way it did it was it scaled up thousands of methadone centers. So we need to learn lessons from what has happened in the drug sector and look at it from the point of view of people who use drugs. Elsewhere, I don't know where we are headed. It could be much more disastrous than what we are seeing already.
And Maria, I understand you've been reporting on this in the Philippines and reporting on some of the personal impact that these extrajudicial killings and these killings are having. Could you just give us an idea of what that personal impact is to some families there in the Philippines?
Well, absolutely. Human rights groups are up in arms, and Commission on Human Rights. There was actually a Senate hearing on this. And again, you have a government that has the supermajority in the Congress and in both the House of Representatives and the Senate. So politically, this is a government that has great power. And what human rights groups are pointing out is that that power is extending to impunity to kill. This is something that's also alarming, is that most of those deaths are happening in the poorer areas. So if you take the idea that the demand remains, then and the supply, the drug supply becomes constricted, and then the prices increase. There's still the problem is becomes exacerbated. It becomes worse. I think the problem now that most Filipinos are dealing with is the climate of fear that this instills. Having said that, you speak to taxi drivers, people who are walking in the streets. The irony, of course, is many of them will say that they feel safer. And this is the great divide. I think part of what you're seeing in our society is that the Filipinos who voted for former mayor, now President Duterte, feel like he is doing a good job. He speaks tough, he talks tough, he walks the talk, and they feel like they want more of this. He's promised 100,000 deaths.
All right, Maria, I'm just going to ask you to stay on the line. We're going to take a quick look at a report now that as Duterte wages his war on drug peddlers and addicts in the Philippines, many are calling for a focus on the opposite end of the process. Much of the methamphetamine on the streets of Manila begins life in South Asia. This next report breaks down some of the global supply chain of narcotics.
Philippines President Rodrigo Duterte became world famous for his so-called war on drugs. The streets of Manila and many other cities have witnessed violence and extrajudicial killing, mainly directed against drug addicts and end users. According to the Philippines police, nearly 2,500 people have been killed by now. One of the most common drugs on the streets of Manila is methamphetamine, or shambu as it is called locally. It is similar to cocaine, crystal-shaped but more powerful and more addictive. Methamphetamine is making the fortune of many criminal organizations worldwide. It is easy and cheap to produce. There is no need for natural precursors like opium poppy for heroin or coca plants for cocaine, nor of large spaces. The entire processing can be done in a lab. Myanmar is the world's largest methamphetamine producer. In June 2016, Myanmar police seized methamphetamine tablets with a street value of more than $36 million. A few months earlier, they seized methamphetamine worth $100 million. The chemical ingredients are legally and widely available in neighboring China and India and are smuggled every day through the borders. In September this year, Myanmar police seized 60 kilograms of Indian ephedrine, the main ingredient for making meth, worth roughly
And we just had to break out of that report there for some technical difficulties, but we're going to continue our discussion here in the studio and with our guest on the phone in Manila. Kunal, I want to come to you. We saw in that report, before it's cut out there, they were talking about the challenge that methamphetamine is bringing to the global drug policy maker. Is that the biggest concern when you go to the UN, when you speak to people in the global drug policy community? Is that their biggest concern going forward?
Indeed. You've just hit the problem on its head. I mean, methamphetamine, if you just go scan through the World Drug Reports in the last 4 or 5 years, you will see from being the fourth or the fifth most problem drugs, it has gone up to number 2 in the latest World Drug Report. And what you also see is a reverse in terms of trend. Everywhere. I mean, to speak of India, our office had done a small study in 5 cities of India to just see, kind of explore how the problem is panning out. And we noticed 2 things. We noticed that it's different from the previous years in the sense that you have new people using. It's not the same old, people having problems with alcohol or opioids or heroin, so to say. So we have new youngsters having easy access to money, school dropouts, English speaking, having problems with this drug. And the other thing we are noticing along the borders of India, especially the eastern borders, is people who are already onto opioids, doing also experimenting to some extent with meth. Right. So of course, if you look at it in terms of the response side, there is practically limited to no experience in terms of how to handle this problem. So, and that resonates very quickly also with what you are seeing in the World Drug Report, which is very high death due to issues like drug overdose. So you have more...
Specifically with methamphetamine?
Also, I mean, primarily with, we have a way of calling it new psychotropic substances, which includes meth primarily, but other drugs also. But what you're noticing is this new culture of new psychotropic substances, especially meth, along with opioids and some other synthetic drugs, also, of course, sourced out of our region. And being very popular, being new, it is also not easy to trace. So, yeah, I mean, going back to Manila, I just wanted to, Giles, what surprised me really in your report was, if you look at the drug problem in Philippines, what we know is also that Philippines happens to, interestingly, be a low prevalence country. If you look at the data from neighboring countries, the prevalence rates are quite high. So, I don't think it requires such a knee-jerk reaction kind of action by the government. And of course, I think to expect any good outcome of it, you have to bring the communities, the affected communities at the center, and health has to be the way forward.
Right, so Maria, I just want to go back to you in Manila for some closing thoughts. Maria, was there recognition, we've been talking about Duterte's war on drugs, his anti-drugs policy, was there a recognition before he came into power that the Philippines did have a problem with that methamphetamine, or has it been overplayed?
There's definitely not just anecdotal, but also data that Shabu methamphetamine abuse on the rise, particularly among the poorer sectors of society. It was so cheap that young kids were easily hooked on it. However, at the scale and the numbers that have been pushed out by this administration, there's still doubt about that, and that needs to be pointed out. From surveys that were done a few years back, it ranked 7th or 8th in terms of concerns of Filipinos. And within the campaign period, last April to May, it moved from number 7 or 8 to number 1.
Maria,
as the top campaign promise of Duterte.
Maria, is that in terms of overall all different policy issues going into the election? It was at 8th, 7th, you said?
Yes, these would be the top concerns of Filipinos in general, and the top one being jobs, health is number 2, and then moving into the campaign season, it became the top campaign issue of then Mayor Duterte from Davao, which catapulted him to the presidency.
And Maria, just want to get a sense from you. You've said that there are very few sort of anti-Duterte voices in terms of in the political scene there. What are some of the opposition voices saying about Duterte's policies?
There's definitely great concern about the impunity to kill, about the numbers, this increasingly high number of death toll from July 1 until December 14. Those numbers that were quoted earlier cover the period from July 1 to December 14. You have a man who was elected. There was a field of five candidates. He won roughly 30% of the vote. And while he has a supermajority in Congress, the opposition remains fragmented, but they're starting to coalesce around the idea. 2 ideas. One is the extrajudicial killings, and then the most interesting one is the resurgence of the son of former dictator Ferdinand Marcos, who was ousted in the Philippines in the 1986 People Power Revolt. He ran for vice president and came within 200,000 votes of winning the vice presidency. He seems to be the favorite of President Duterte. President Duterte has taken him on his trip to China. And the last issue that actually stirred great dissent in the last few weeks has been the burial of Ferdinand Marcos in what's known as the Heroes Cemetery.
Right, and just to finish up this discussion, Kanar, I just want to get a final thought from you. We've been talking about the extreme policies that we're seeing in terms of the war on drugs in the Philippines. What's the other option in terms of the thinking in global drug policy now? Which direction is that going in terms of the think tanks, in terms of the discussions you're seeing?
Yeah. Giles, I mentioned about the UN General Assembly special session on the world drug problem, and I think one of the biggest outcomes of the whole discussion was an agreement amongst the member states that it is a public health centric issue, and it must be dealt with, that being the focus. And not to miss out, we had a very vibrant civil society participation, and bringing out people in the center, their rights as being central to the whole debate was a very instrumental outcome. That was quickly followed up also by revisiting the tools that are available. So we already at the global level have tools on how to look at early intervention in the form of primary prevention. We have tools for treatment and we have tools for care. The thing is, if we don't do it now and if we don't do it sufficiently, we will not get the results. So Philippines, I think what we are missing out perhaps is quickly a revisit on the policy part to make it health and human rights centric. Perhaps looking at harm reduction as an option, which they need to urgently try, to look at how to bring the drug users on the fold, because many of them would be hidden because of the current developments, and you will never grapple with the problem.
Right.
And last but not the least, I think the issue of reaching out to people who are unreached, and not to mention, we didn't discuss the women aspect. There is a lot of gap in terms of treatment and access issues are there, so we need to look at other populations. Just to conclude, I just now looked up and I found that some 40,000 people were under detention. Just imagine an outbreak of any form of communicable disease, TB, HIV, hepatitis, you completely lost the plot. So I think we need to quickly look at health and harm reduction measures to deal with that issue.
All right, so I'm afraid we're out of time, but Kunal Kishore from the UN ODC, thanks for your inputs on this discussion, and Maria Ressa, the Executive Editor of Rappler in Manila, thank you very much for your input too. We're going to take a quick break now, but when we come back, we'll be discussing possible accusations of Chinese militarization in the South China Sea. Stay with us.